That is a surge team doctor who spent 24 hours this weekend as an extra frontline worker in the ER. And he is noticing that some coronavirus numbers are beginning to level off in our state.
There's some encouraging news out there. This doctor's also been dealing with some of the things that happen to people after they recover from the virus. Spencer Blake brings us insight from the ER.
After his first weekend of 12-hour overnight surge team shifts in a Banner emergency room, Dr. Andrew Carroll is exhausted. He says it was surprising to see how much of the hospital is currently dedicated to intensive care.
Pretty much every floor had negative pressure rooms to care for patients who were COVID or COVID suspect. That I've never seen.
From his perspective, the COVID-19 cases aren't coming in as a flood right now, more like a flowing river. He suspects the mandates to shut down bars and gyms again are starting to work.
We are seeing the results of that in that we're seeing less cases. I'm not only not seeing less cases at my clinic, but we're also seeing less cases in the emergency room.
But he says we still want to get our thousands of new cases each day down to the levels we were seeing in April. The scary new things he's seen are the problems and symptoms people have after they have the virus.
We're seeing neurologic symptoms, problems with their nerves. We're seeing prolonged fatigue from being so darn sick. And then we're also seeing other disorders like diabetes, new onset diabetes in patients who never had diabetes before.
Dr. Carroll emphasizes that this is so much more than just a cold or flu. After all, he is listed as a disaster relief doctor on his badge. While he's honored to help other doctors out, there's still a long way to go, and it's still too early to tell what the future holds for recovered COVID patients.
Really, the key is don't get this illness. Do everything in your power to protect yourself, protect your family.
I'm Spencer Blake for Arizona's Family.